Hi, welcome. This topic we will cover new by mouth or which procedure, test, treatment needs new by mouth and which one doesn't. As well, I'll provide some diagnoses and procedures, how we can summarize them. Okay. So you can download the templates at the below descriptions. This presentation is for the purpose of private study and research. I used Kaplan, UWorld, Registered Nurse RN, NCSBN, and other resources for this presentation, as well for my study. So I'm gonna move here. NPO, and here is do not need to be don't need to NPO, and here is NPO. So for example, with the NPO procedures, new by mouth, we got in NCLEX RN with select all that apply. They really like to ask these questions. Patients on ECT, before the ECT, they're gonna eat something or have some fluids or something. Then that's when you need to know, are they allowed to eat or drink something before the procedure or not? So here, NPO is all this, and no need to NPO. So the tricks to this is, I just remembered the no need to NPO sections. You got the disease, test, treatment, and surgery. I just remember all this, and that's it. With the NPO here, in the question, once you remember here, and then if the question doesn't say this, then most likely they need to be NPO. That's how I tackle that NCLEX RN questions. For example, patients on sickle cell crisis, and then patient would like to eat something. A patient stable and would like to eat something. In that situation, should we give or should we not give? In this situation, yes, no need to NPO, so they can eat and drink. And for example, interesting is 1 hour oral glucose tolerate test, you don't need to fasting. Well, for 3 hours oral glucose tolerant test, you do. So, for example, the NCLEX RN questions could say, patients going for 1 hour oral glucose tolerance test. Then our answer mostly gonna be they can eat and drink. Well, if they go for 3 hours oral glucose tolerance test, you want to make sure that they fast before they go for the test. So that's how I differentiate left table versus right. Best to, I'm gonna, so as I say, just remember this section. That's all you need to do. And done. All right, let's move on to the next one. Iodine. We're gonna, what I do is, here are the following tests that, diagnoses that, here are the tests that require using iodine. So iodine, we put it on the left side, before the iodine, what you need to do. And then on the right side, it's afterwards. So that's these two. But then here, it's the test we do, which gonna use iodine. And then you just write the point form about radioiodine uptake. In your NCLEX RN question, you see radioactive iodine uptake, and you made a mistake on this part, just write a notes on here. So the main point for iodine is allergic to the following seafood, and you probably want IV line checked, except myogram, because they are inserted into spinal subarachnoid space, not the through the artery. And then iodine excrete through kidney, so you want to watch out for BUN creatinine output. Sometimes the question could say, patients gonna have this test or any of these tests, and then BUN showing something, so with abnormal range, and then that's something that's questionable, which you need to inform the doctor. Next one is MRI. So Iodine, MRI, they are quite two popular one. So you don't need to NPO for the MRI, except if for sedations. And the following conditions patients can have MRI, and following condition patients could not. So these are just the example. There are so many lists of conditions contraindicated to MRI. So on your notes or on your NCLEX RN question that you encounter, just write down here. Diagnosis and then the disease. I just want to point out that with diagnosis, for example, lumbar puncture, it's used for multiple, to diagnose multiple conditions. It's not just one. So it's good to know. For example, 24 hours urine, you're used for these 3 conditions. And then the NCLEX RN question could ask, say, patient has Addison's, and then what kind of diagnosis test can we do? Then we can say 24 hours urine. Again, similar. So you have the conditions and then a diagnosis. For example, conditioned TB, and then you have diagnosis that you can use. And then priority, like for this procedure, what's the priority things we do, and how should we manage it as a nurse, pre and post, after, before the diagnosis and after diagnosis as a nurse, what can we do? If you do lots of NCLEX RN samples, you're sort of familiar with the structure, what are they asking. This time is the procedures rather than diagnosis. For example, you write down the disease and then the procedure, and then take notes of what NCLEX RN question gonna most likely test you on. And that's it for signs and symptoms. I hope that will help you simplify the NCLEX RN exam. And feel free to send me an email, and then if you got any questions.